I'm now going to invite Ms Elizabeth Kleinig come here. As most of you guys know, she's a clinical manager of maternity at Calvary, North Adelaide for some 10 years. And Liz became an RN at Royal Adelaide Hospital and has over 30 years of midwifery experience in Scotland, Alice Springs, and Calvary, North Adelaide. And so has an extensive personal experience of the changes in perinatal care, particularly outside the public hospital system. Thank you, Liz.
One finds it very difficult to say no to Brian Weekly, so I find myself standing here. I've worked in midwifery for 30 years, and over that period of time I've seen quite a marked difference in the way we do things and the age of women who present to have their babies, first babies, second babies. Just anecdotally, when my mother had me when she was 42, but I was number 5. So that's a slightly different perspective to now, where people were perhaps having their first children at this later age in life. So anyhow, I thought I'd just have a look at some of the stuff that's out there. I saw Tamara, she was 47, she's a teacher. I figured she'd have pretty good access to the internet and that she'd mostly be doing a little bit of research, maybe at school or after hours, and there was a huge amount of stuff that she could come across telling her about what could be expected at 47. She has an advantage, she's had a baby before, but there's all sorts of information, whether the information she gets from the internet or from any of these websites, older mothers, mothers over 40, Amazon bookstore, mothers 35 plus, whether that's all relevant for her is another question, but I suspect she's been there and read that and had a look and wonders why perhaps things aren't happening the way she might have thought. Anyhow, Tamara, she comes in labour and she's had her baby, and as has been alluded to by the previous speakers, she has some medical issues. So I'm looking at this mainly from a postnatal sort of perspective, but we'd be really concerned for this woman because she's not only got essential hypertension, but she's been showing exhibits or signs of preeclampsia as well. So once she's had her child, I think we'd really need to look at her very closely, watching her blood pressure, need regular checking, look at the other sorts of aspects, her headache, visual disturbances, whether she's got any epigastric pain, the basic midwifery stuff that we do looking after her. And then just general observations, her loss. Will she be at a greater risk of postpartum hemorrhage because of the myometrium? So I would be looking at that as well to make sure that all those things are covered in her initial postpartum period and also in the next couple of days. The other thing that came to mind when I was looking at this case was she's got a preterm infant, and Chris has already alluded to some of this stuff that I'm going to look at. Size and gestation of this baby. How long will the baby be in special care? Will she have to go home before the baby's ready to come out of special care and then come back to room in or whatever? Then the separation issues that go along with that. But maybe she's got some issues around, has my age caused this to happen? And I think we'd maybe need to look at that very carefully and help her around those sorts of issues as well. Because even though she's spontaneously pregnant, she may have thought that this may have had some impact on the fact that she's got a preterm birth. Maybe feel a bit guilty there. A lot of work will go around lactation, assuming that she wants to breastfeed. I'm assuming that she will want to breastfeed, but she must want the best for her child. Has she successfully fed her first child? Does she remember what it's like? Does she know what will happen? Does she remember the lactation process? Will it be possibly impeded by medical issues or tiredness or medication? How's the baby being fed in the nursery? Is it going to be gavage fed or whatever? Is the concept of skin to skin new to her? She had her first baby 19 years ago. Well, that was mostly not heard of or not done very frequently. But nowadays, putting the baby onto the skin to skin to help may have some impact for her. She may not like it, but it's been shown to be beneficial. And to encourage and to commence expressing to give the best start for this baby. All this while she's thinking about, I've had the baby, I'm tired, I've got all these other things that I've got to do, and there's a lot to go on there. And then the other considerations we looked at, which I've sort of touched on, how has the care changed over the time difference between her first child 20 years ago? Will she adapt to that change? I suspect so, but there's lots of things that she may have to look at. Perhaps the more the less rigorous approach to perhaps 4-hourly feeding, which was perhaps more common then, and it's certainly more promotion of demand feeding, but making sure the baby still gets the right amount of feeding. How has mum changed in that period of time? She's obviously changed a lot. What sort of education do we need to do with this mum around breastfeeding? Does she actually know about the new sorts of things re safe sleeping? So there's a whole period of thing to look at there. She may have well put her first child to sleep on its tummy on a sheepskin 20 years ago. Well, that's certainly not going to happen now, so we have to re-look at that. She's going to be putting the baby on its back, not overly wrapped, all that sort of thing. So there's a whole aspect of education there. Has she handled a small baby recently? Does she remember how to bath a small baby? So there's those little things about teaching her to look at how to handle a baby, how to bath a baby, how to change a baby. How do her family view her with a new baby? Is the 19-year-old really excited, or is the 19-year-old a bit, my mum's had a baby, that's 19 years ago, she's actually had sex with my husband. That's, how does that all that impact on the care that's going to happen? She's likely to be extremely tired. Everybody's tired when they have a baby. It's hard work, even more so when you're 47. What sort of support does she have? And as somebody alluded to before, her parents are likely to be quite elderly. Are they able to support? Are they physically able to support, or are they even alive to support? So there's those sorts of things that she may have to think about. And how does she think she's going to manage when she goes home? What sort of things are going to happen? It's a total lifestyle change. So all those sorts of things we try to address in the first couple of days in hospital. This is a really brief overview, and a lot of you out there have got a lot more experience, or as much experience as I have. So if you've got any other comments to say, I'd really appreciate them. And then I just thought I'd quickly look at some very famous, or no, perhaps not so famous, older women. As you can see, there's Sherry Blair, and they're just some odd pictures around about. And just to end up, we have alluded to the fact that some of what we're thinking is not suitable for older parents, and I did like this one.